Good morning. My name is Heather Ireland. We're going to be going over the bag valve mask technique today, or BVM as we tend to refer to it as. Now, we've been discussing it in class and going over the actual use of it, the techniques, the specifics of how to use it, but we're actually going to put it into practice today, use it on a mannequin, not each other, but use it on a mannequin. So we do want to review, go ahead and make sure that we remember why we're using the BVM. Generally, it's because our patient is not adequately breathing on their own. That can be either breathing too fast, but generally more likely we're using the BVM because they are breathing too slowly. Either they're not breathing at all, such as in a cardiac arrest, and we are literally breathing for them, or they're just not getting enough breaths. We're trying to coax them up to breathe with us, breathing more at the rate that we need an adequate adult to breathe at, or if they're hyperventilating, we can also use it, kind of coax them to breathe with us and slow down their breathing, okay? This is our typical adult BVM. You may have to actually connect it to the mask yourself. Normally when you pull it out of a bag, it's actually going to be compact like this. You'll have to pull it out before you utilize it. You will need to attach it to oxygen. We do have attached to oxygen over here just very briefly so we can see how we want it to be inflated before we actually start ventilating, okay? So we want to make sure that the bag itself is fully inflated before we actually utilize it on a patient. That's generally about 15 liters per minute on the oxygen tank, okay? I'm going to go ahead and turn that off so we don't utilize all of our oxygen before we need it, okay? When we are using the BVM, we also need to make sure that the air is going to be able to get through the mouth, the airway, into our patient's lungs, okay? So we need to check for any obstruction, if they're vomiting or if they have any secretions that we may need to suction out. It's not going to do us any good to be bagging a patient and have the air, the oxygen, not getting to the lungs because it can't get through something in the esophagus, in the airway, okay? We may need to do a head tilt chin lift method to make sure that they're in the sniffing position and that their airway is nice and open for the oxygen to get to them. If they're a trauma patient, of course, instead we want to do more of the gentle jaw thrust method, okay? Again, we need to make sure that the airway is patent before we actually try and deliver any oxygen. We may also need to have an NPA or an OPA to help keep that airway open. Again, the oxygen is not actually getting to the lungs, then it's not benefiting the patient, okay? So, as we discussed in class, we just went over, this is what BVM looks like. You need to make sure that it is fully functioning, no leaks in the bag, anything like that, before you utilize it. Typically, truck check off, something like that before you run a call. You want to make sure that you are using the correct size mask, okay? Generally, for most adults, the size that comes with it, at a medium, tends to fit them, but if you need a large size or a small size, you need to go ahead and get a different size mask. Again, if you do not have a good seal on the face, around the nose and mouth, the air is going to go out of the gaps in the seal rather than into the patient's lungs, and thereby it's not benefiting them, okay? So you do want to go ahead and get it over the nose and mouth, and then you want to use what we call the CE method, okay? So you use your index and your thumb to form a C right around the mask, okay? To try and keep that nice seal right there over the nose and the mouth, and then you kind of grip the jaw and the mandible with your other fingers to make sure, again, you're holding a good seal. That's what you do if you just are one person that is going to be holding the seal and bagging all on your own. If you have the benefit of having someone else, go ahead and have one person just holding the seal, making sure that all of the air is staying in there, and then another person can be bagging. Okay, so that's how we want to make sure that there is a good seal. You also have the option of, if you have CPAP masks on the truck, they can be used to really help get that seal if for some reason they're just a larger person, or even actually if they're a much smaller person, kind of gaunt. This can help get the seal. It also helps attach all the way around the head to give you a little more security so that you can focus on bagging. So that's something you can keep in mind. Also, before I forget, you may want to connect the end tidal between the mask and the rest of the bag valve mask, okay? This is what we'll need to ensure that we're tracking their capnography. Very important for making sure that we are ventilating appropriately, not hyperventilating them. So that is also something that you want to keep in mind when you are putting the BVM together. So again, once we have this nice tight seal around with that C and that E, now we want to focus on the breaths, okay? You want a nice gentle and gradual push on the bag. We do not want to just squeeze and be going like this. Yes, we are getting chest rise and fall, but this is also not adequate breathing. This is too fast, too inflated. Again, we are trying to breathe for them naturally. We are trying to have it just nice and gentle. For an adult, so remember in class, once every 5 to 6 seconds. For a child or an infant, once every 3 to 5. Of course, with a child or infant, we would be using a pediatric bag valve mask, not an adult BVM, okay? So just enough for chest rise and fall. Make sure, again, and if you're not getting it, if like for some reason we're going here, I'm not getting that chest rise and fall, oh look, we came off of the nose. You wanna go again, get that good chest, that good seal, and now we've got a better chest rise and fall. And it might be a little easier if we watch it with the oxygen, kind of see how it flows. And with the oxygen going, we're also going to be looking, when we have a patient, better coloration, okay? Oxygen saturation, we're aiming for above 94%. Again, just gradual, just enough to get a little chest rise and fall. We don't want to squeeze it all the way, because that can overinflate actually the gastric region. If we're putting too much air into the lungs and it needs somewhere else to go, that's where we can get some gastric dissension. We also want to check thoroughly for leaks. If we're bagging them and everything seems to be going pretty well, but then the oxygen saturation starts to drop, maybe our grip changed, maybe we have a leak. We need to be constantly checking the effectiveness of our seal and of our ventilations. We want to also make sure that if they were vomiting before and we had to suction them before bagging them, we may need to continuously monitor that and check every once in a while if we're starting to get bad compliance, if we're not being able, if we don't feel the air going appropriately into the lungs, we may need to have someone suction, check for an airway obstruction again. Okay, so again, coming in, we're trying to get that good seal. It's easier on this side. Get that good seal around the chest and easy chest rise and fall. Nice and easy, every 5 to 6 seconds. Just keep it going. It's a little hard to keep it inflated without the oxygen. All right, we're going to have one of our students come up and try and utilize this as well, see if we're able to apply the information appropriately. Lily, if you could come join us. And what we're gonna do is we're just gonna have her just come up on this mannequin and just get everything set up just like she would going to bag someone cardiac arrest, respiratory distress, something like that.
Do I have to talk?
You don't have to talk, but if you have any questions or anything as you go through it, feel free to ask.
Okay.
Do you have any questions or anything that needs clarification before you try it yourself?
I don't think so.
Okay, let's go ahead and try for it.
Okay. Well, I'm gonna put the mask on.
Yes.
Gonna make sure the supply tubing is nice and on there.
Yep.
Hooked up to the oxygen.
Good.
Do you want me to turn the oxygen?
We can turn it on so that way we can make sure, like I said, we want to make sure that there aren't any leaks on here, because if it is leaking, it's not filling up. All right.
No leaks.
No leaks. And fully inflated before we start going. Perfect.
Oh, it's covering his face.
Yep. And that's where you're right. Sometimes it's hard to figure out where you are. This is also on a table, so we generally wouldn't be bagging someone right in this area, so it's hard to get that angle. Now, are you able to see chest rise and fall when you squeeze? Only a little bit, so we might not have as strong of a seal. Perfect.
That's even worse.
And it might, so just, so you know how you're doing as like a U right there, if you try and come around a little more, have your thumb on there and really push down that way, see if that works. A little bit better? No?
It's like nothing.
Okay, because this is wide open. So this is a great example of where we would be probably moving to a different mask, or if, say, hey, there are other firefighters on scene. She'd say, hey, I can't get a good seal. She would say, Heather, can you come over and try and get a good seal on mask? So I'll do this. Let's see if that works. And see, there we go. Sometimes that's why the preferred method is having two people do this together, okay? And do you feel on the mannequin that you were getting good compliance?
Yeah.
Okay, perfect. And see how she's doing it? She's squeezing it halfway. She's not squeezing it all the way, which we laugh, but sometimes we do see that on scene. If it's a stressful situation, obviously we're trying to get the oxygen there. It's understandable why that would happen, okay? Does that feel a little more comfortable?
It does.
Okay.
Should we use this?
Yeah,
What
so
is
we would
that?
go ahead, that is for our end title, as we discussed, so we would kind of just plug it right in between there so we can check our capnography, okay? This is how we'll check the waveform. This is very important, particularly on a cardiac arrest, to make sure and see if we're getting good waveform and within the right range of 35 to 45. Now we can also check on an actual person, breath sounds. We would listen to that, like we said, we'd look for capnography, and we would also look for oxygen saturation. Our goal is above 94%. Okay? Perfect. Thank you. Please hold.